It's Mad Dog backstage here at day 3 of Route 91 Harvest Festival.
We're honky tonk time.
It's Sunday Fun Day.
Yes, it is.
I love country music, so to me it was another event that I was just excited to go and be a part of.
We're out in Vegas for our anniversary. It always falls near when the concert is, and this was our second year attending Route 91.
It was just supposed to be a girls' weekend. I am a single mom, and I had a free weekend, and I thought it would be fun to do something with some friends.
Just letting you know we have a possible active shooter situation at the Route 91 Festival.
Hey, do you guys have direct pressure on that wound?
Direct pressure on the wound, yes.
It's 12 critical. Extremely critical.
Okay.
Rapid transport out of here.
I got a text from one of my charge nurses. They said there was a ongoing mass shooting.
It was a feeling of sheer panic and chaos, and I didn't know what I was going to walk into. There was blood all over the floors. There were a lot of ambulances and cars outside the emergency department.
I walked in through the EMS entrance that all the ambulances go through, and I noticed that there was a blood trail, and I just followed that.
When you walk in that ER, there's a red line, and it says trauma. There was a lot there. I could just say that there was so much blood on the ground that you couldn't see that red line anymore.
My first, clear memory of the event was just the sheer number of wounded that we had that were in every space of the emergency room.
And standing in the trauma bay talking with Dr. McIntyre as we were trying to organize our response, I knew it was something that we've never seen before.
My role was to oversee the preparation, cleaning, and sterilization of surgical instruments. On an average night, we would have produced about 120 surgical trays, but the night of October 1st, we produced just under 700.
From what I understand, we intubated over 60 people. We put over 60 people on ventilators. That's a lot. I mean, anyway, that's just a lot of critical patients at one time to handle.
My primary job that day was going from place to place to place with pictures of family members, their tattoos, their piercings, anything that could identify them as the family member that was waiting for them down in the Family Resource Center.
The survivor event is so very important. It's an opportunity for survivors, for our staff, for our physicians, and the community to come together. A time of healing, but also a time for us to move forward.
Today is the first day that I've been back to Las Vegas since the shooting, and it's kind of surreal. It's kind of heavy on the heart. I'm incredibly grateful and thankful I'm able to see the staff. It's wonderful to see the outpour of love. And a tragedy such as this, it's so wonderful just to see the love.
I work with the absolute best people at Sunrise Hospital. It was just amazing to watch everybody just stay focused on doing what was right for the patients.
The care and the love and the services that the hospital provided was amazing.
It was amazing to see all these people come in. You realize how big of a team you are, and not one person is the critical person that is in charge. You realize everybody has a role and it needs to be done, or the patient's not going to be able to make it.
You know, we're in healthcare because we're committed to caring. We're committed to taking care of people. And even though I'm not a direct caregiver, that's not my normal job, I am still part of the caring team of Sunrise Hospital Medical Center, and we're all committed to the same mission, which is making sure that we take care of every person who walks through our front doors. And that's why I'm committed to care.